Presiding Officer, tonight almost everyone in the world will be supporting Ukraine, and if they were playing any other country in the world, I would probably be supporting them too. But as they are playing us, I'll be cheering on Scotland and the Tartan Army. So can I wish Steve Clarke, Andy Robertson and the entire Scotland men's football team all the very best for tonight. I hope they can take us to a World Cup. Presiding Officer, can the First Minister tell the Chamber how many people were on an NHS waiting list a year into an SNP government, pre-pandemic in March 2020, and how many Scots are on an NHS waiting list now?
First Minister.
I'll provide the precise figures. I don't have them to hand. What I do know is that there are more people on NHS waiting lists now, post-pandemic, than will have been the case at many points over recent years. And that is the case not only in Scotland, but it is the case across the UK and across much of the world because of the pressures of COVID. I also know that before we had the pandemic, there was significant progress being made in reducing waiting times. So if we take outpatients, for example, before the pandemic, the number waiting for a first outpatient appointment had reduced by 21.3%. Over the same period, the numbers waiting for over 12 weeks for an outpatient appointment had fallen by more than 30%. More appointments had been carried out in terms of the inpatient treatment time guarantee, and the number waiting over 6 weeks for one of the 8 diagnostic tests were down 25%. So that's the progress that was being made. That has been clearly set back by the pandemic, which is why our recovery plan and the significant additional investment going into the NHS is so important.
Hannah Sarwar.
The First Minister doesn't need to send me the stats. I've got them for her right here. The answer the First Minister was looking for was there were over 260,000 people on an NHS waiting list a year into an SNP government. That had risen to almost 420,000 on a waiting list pre-pandemic in March 2020. And today that stands at over 708,000 people, 1 in 8 Scots on an NHS waiting list. And the First Minister references the recovery plan or catch-up plan. Surely catch-up means the number waiting would go down instead of going up. But there are nearly 60,000 more people on an NHS waiting list compared to when the government announced the catch-up plan back in August. So let me try another one. How many people were waiting over a year for inpatient treatment when the First Minister took office, and how many people are waiting over a year today?
First Minister.
There are more people waiting over a year today, and I think most people understand that that is because of the impact of the pandemic. And in fact, the latest quarterly figures show an increase in people seen, inpatients, outpatients and diagnostic procedures compared to the previous quarter, which again shows the impact of the improvement and catch-up work that is being done. But of course, we're in a much better position, but we are still in a pandemic. And since the recovery plan was published, we've had another wave of the pandemic. I think people understand the impact that that is having in our NHS, but they also see the increased number of people working in our NHS, they see the increased investment in our NHS, and they will start to see the increase in terms of numbers seen, and yes, that impact on waiting times. But regardless of what party is in government across the UK, SNP in Scotland, the Tories in England, Labour in Wales, the NHS is facing the same challenges, but of course on many of these measures the NHS in Scotland is doing better than the other UK nations.
Anna Sarwar.
I've already referenced to the First Minister that the figures are going up since the catch-up plan, not coming down in terms of those on waiting lists. And as is typical when the First Minister is struggling, she wants to talk about Wales. I remind her she's paid to care about the people of Scotland because she's Scotland's First Minister. But here's the answer the First Minister couldn't give or doesn't want to give. And let's remember that there is a legal guarantee of treatment, a legal guarantee for treatment within 12 weeks. The number of people waiting over a year when Nicola Sturgeon took office was 21. As of today, that number is over 30,000 of our fellow Scots waiting over a year, not the legal 12 weeks, waiting over a year for inpatient treatment like a hip replacement, a knee replacement or a heart operation. So let's look at Nicola Sturgeon's record on the NHS. She's broken her own treatment time law 490,000 times. She's cut over 4,000 beds out of our NHS, And on her watch, we now have record vacancies for nurses and midwives. We are 6,000 nurses and midwives short. This is a litany of failures. A black hole in our public finances, railways that don't run, ferries that don't sail, and soaring waiting lists in our NHS. Which one is Nicola Sturgeon most ashamed of?
First Minister.
I'm proud of the work that this government does to support the NHS. I'm proud of the fact that there are thousands more people working in our NHS, and I'm proud of the fact that I think the NHS budget has increased by about 90% in cash terms since this government took office. But Anas Sarwar literally must be the only person in the country, perhaps the only person on the planet, that doesn't understand or is not willing to understand the impact of a global pandemic on health services in Scotland and around the world. We were seeing significant improvements before the pandemic. The pandemic, when we literally had to pause surgery and other treatments in the NHS, has clearly set that back. And now we are investing and introducing the initiatives to catch up on that progress. Anas Sarwar also mentions beds. And I know he doesn't like comparisons to Wales when they don't suit him. But the Royal College of Emergency Medicine, of course, who were talking about bed numbers this week and said important things, also pointed out that Scotland has a higher number of beds per head of population than Wales and England. So, yes, we have lots of work to do, but we have a better foundation to build on than where Labour is in government in the rest of the UK.